Hi, my name is Derek, and I'll be going through the steps of what is needed to be done to complete an assessment of the heart. First off, you should ask if your patient has had or is experiencing chest pain, shortness of breath, heart palpitations, blackouts, strokes, or any other related cardiovascular problems. Then you will check the neck and look for any jugular venous distension. This begins by first asking the patient to lay supine at a 45-degree angle as they turn their head to the left, exposing their sternocleidomastoid. In between the two heads of the sternocleidomastoid will be the internal jugular vein. Check and see if there is a pulsation and make sure it is indeed the internal jugular vein you are checking by making sure it does not coincide with the radial pulse. After, if the jugular distension goes away when compressed, it can be confirmed with a comparison to the angle of Louis. A normal distance is from 2 to 4 centimeters from the angle. Anything further and this could indicate right-sided heart failure, constrictive pericarditis, or tricuspid stenosis. Next comes the auscultation of the heart and its valves. This can be done by listening to the aortic valve at the second right intercostal space near the sternum, the pulmonic valve at the second left intercostal space near the sternum, the tricuspid valve along the sternum at the fourth intercostal space, and the mitral valve at the fourth intercostal space at the left midclavicular line. The aortic and mitral valve are quite important since the heart sounds S1 can best be heard at the mitral and S2 at the aortic. A normal heartbeat contains sounds of its valves closing. These can best be heard through auscultation and are called S1 and S2. A normal heartbeat sounds like, while an abnormal heartbeat can have an S3, commonly associated with left ventricular heart failure, or an S4, blood trying to enter a stiff left ventricle during atrial contraction. There can also be heart murmurs heard during auscultation, such as valve stenosis, a valve that does not open fully, or valve regurgitation, a valve that does not shut fully. Finally, it's time to palpate the chest, look for, and read a person's point of maximum impulse. First, place the palm of your right hand across the patient's left chest with your fingers extended below the nipple. Look for the point of maximum impulse, which will usually be around the apex. A normal sized impulse will be about the size of a penny. You should check and see the duration and vigorousness of the impulse, as a more vigorous impulse could indicate ventricular hypercontractibility, and a long duration compensated mitral regurgitation or aortic insufficiency. And with that concludes the assessment of the heart.